Coronary CT Angiography, CCTA, is a powerful tool that uses CT technology to visualize blood flow through the small arteries that feed nutrients to the heart muscle.
My family history was terrible. Both my parents had a lot of cardiac issues. So probably 4 or 5 years ago, I started coming in and having a cardiac CT every couple of years just to see how things were going. And
the exam itself just takes a few seconds. The CTs are quite fast, and then after that it goes into some various processing software, and then a radiologist will read it out.
A coronary CT angiogram is a non-invasive exam that examines the walls of the coronary arteries to evaluate the presence of hard and soft plaque. Information from the exam can help your provider determine your risk of heart disease and develop an appropriate treatment plan.
The first couple I had were fine, but they showed some increased blockage in my arteries. And then it was about 2 years ago, June, that I went in and had my regular CT angiography study, and the results seemed to indicate that I should strongly consider a heart cath.
Well, there's a couple of different things that these images are used for. One is evaluating people that are low to intermediate risk, having acute chest pain in the emergency room. And several studies have shown that if the CT angiogram is normal, then it's completely safe to send that patient home. Another use is people with stable angina or chest pain who are intermediate to high risk, and that in that case, we use the exam to look for coronary artery calcification and also soft plaque in the arteries, and to determine whether there are any significant narrowings or stenosis that would require treatment.
If coronary disease is present following a cardiovascular screening test done by your doctor, a coronary CT angiogram may be ordered to help with preventative management and treatment of the disease. Risk factors include an intermediate to high-risk profile with no typical coronary symptoms, chest pain or inconclusive results from a stress test, unusual symptoms for CAD but low to intermediate risk profiles, coronary artery anomalies, the need for pre-surgical coronary risk evaluation, CABG and stent patency, possible subclinical disease, for example, abnormal lipid profile, chronic smoking, or diabetes. Remember, if you experience symptoms such as chest pain, shortness of breath, or fatigue during heavy physical activity, it is important to seek immediate medical attention.
Well, usually it's something that's decided in conjunction with your cardiologist. Generally, it's people who either have known coronary artery disease and we're sort of tracking that disease to make sure it doesn't progress, or people with suspected coronary artery disease who are not having acute symptoms and so don't need to, to be rushed off to the cath lab. And also people who have already undergone a coronary artery intervention, such as a CABG, coronary artery bypass graft, or coronary artery stent. And we can use this exam to evaluate the patency of either the graft, the stent graft, or the stent.
I went to my cardiologist and I showed him the CT. He had a copy of the CT, looked at my background, and said that if I wanted an answer, he was happy to do a heart cath, but it's still not, it didn't look worrisome enough to him. So then that was September of 2021, and then in December was the heart cath, and I went in for the heart cath, and while I'm lying there waiting to be prepped for the procedure, I asked him, so by the way, what are the chances I might get a stent, because this was supposed to be a diagnostic heart cath? And he said that, well, he re-looked at the cardiac CT and felt like probably 60% chance that I was getting a stent that day. And in fact, I got 2 stents. And they were in an area that were not life-threatening, but could, in 6 to 12 months, could have been a problem for me, cardiac-wise. So I feel like the cardiac CT was extremely helpful.
Well, there are a couple of benefits, one of which is it's non-invasive. So besides putting in a small IV for the contrast, we don't need to really access any of the larger vessels like you would with an angiogram.
I wouldn't have gone in if I didn't have such a bad family history. This isn't for everybody, but those people where the indications are appropriate, I think it's an extremely useful tool, and I'm glad I did it.
For the most part, it's fast and fairly easy on the patient, and gives us a lot of diagnostic information.
Inland imaging has radiologists that are especially trained in reading those studies, so I felt like I was really in good hands.
To find out if our calcium scoring or coronary CT angiography exams may be right for you, talk with your primary care provider or call Inland Imaging. Inland Imaging. Answers you can trust and care you can count on.